afterload refers to the pressure that ventricles should overcome that pressure to open the semilunar valves. We know that opening the valves is due to pressure gradient, pressure difference, and semilunar valves open when we have higher pressure in the ventricle and lower pressure in the artery. So pulmonary semilunar valve opens when pressure in right ventricle is more than pressure inside pulmonary trunk, and aortic valve opens when pressure in left ventricle is more than the pressure inside aorta. At rest in an average sized individual, pressure inside pulmonary trunk is around 20 millimeter of mercury, and pressure inside aorta is 80 millimeter of mercury. So that simply means to open pulmonary valve, pressure inside right ventricle should exceed 20, and pressure inside aorta must go above 80 millimeter of mercury. That's when aortic valve opens. And we know to generate pressure, ventricular walls must contract. So in this scenario, the ventricular walls contract, and we know because in the left ventricle we have a thicker myocardium, left ventricle can generate more force. Simply, myocardial contractility of the left ventricle is higher, and as soon as pressure inside the left ventricle goes above 80 and pressure in right ventricle goes above 20, the semilunar valves open quickly. Now I change the scenario and say, what if in an individual at rest, pressures that we have inside aorta and pulmonary trunk are higher than what they're supposed to be? And as you can see, I chose slightly higher numbers. This applies to those individuals who have hypertension. Pressure inside their arteries is more than what it's supposed to be. So if you think about this scenario, ventricles contract, and the force that they generate first has to be used to open semilunar valve, and then the rest of the force that they generate is used to pump blood out. Because the pressure inside pulmonary trunk and aorta is higher than what it's supposed to be, more of the force that ventricles generate in this scenario compared to the previous scenario will be used to open the semilunar valves. We can say in a simple way, semilunar valves are like heavy doors that ventricles must use more energy to open them, and as a result, less energy is left for ventricle to pump blood out. So we say if afterload, the pressure that we have in these arteries is higher than usual, since more force of what ventricles generate should be used to open the semilunar valve, less force is left to pump blood out. So the amount of blood that ventricles pump out each time that they contract would be less. Stroke volume would be less. And as a result, more blood is left inside the ventricles. Recall that the blood that is left inside the ventricles after they contract is in systolic volume. So that would be the explanation how afterload, increased afterload, can negatively change stroke volume, can lower stroke volume.